Okay, next one. Thank you.
Good evening all. Today I will be presenting a case which is of very rare occurrence. A 15-year-old boy who presented with a soft swelling under right eye upper lid since birth. Parents noticed this swelling under right eye upper lid since birth, which was gradually progressed to current state. There was no history of pain or no history of trauma or any ocular surgery. Patient had history of hairless patches on the scalp since birth. Patient also had a history of seizures around 6 months of age, which resolved with medications. This family history, personal history, rest is not significant. The first photograph, we can see a mass in the superior nasal quadrant and a hairless patch on the scalp. In the positive examination, there is a mild ptosis. Vertical IPF is reduced to 7 millimeter, and there is a epibulbar mass of size approximately 10 by 10 millimeter, prolapsed on everting upper eyelid in superior nasal quadrant with flat mass extending from it to superior limbus, cornea, and there was engorging vessels on it. The rest of the anterior and posterior segment examinations were normal. The patient was referred for radiological examination. In MRI, they showed right-sided cerebral hemiatrophy with intracranial lipomatosis and 2 intracranial cysts. And the well-defined mass was found in the extracorneal space of the orbit. Then dermatology opinion was taken for the alopecia patch, and they diagnosed it as a nevus coeloliparis. So on the basis of history, clinical examination, and MRI findings, the case was diagnosed as a Haberland syndrome. The surgery was planned for the excisional biopsy after thorough investigation. This was the early post-operative photo of the patient, and the histopathology suggestive of a lipomatosis. So these are the various differential diagnoses we should consider. But this Haberland syndrome has been described by Haberland and Peru in 1970, which is also known as Fishman syndrome. This is uncommon sporadic neurocutaneous syndrome of unknown origin. Approximately only 60 cases have been delineated since 1970. Most of the cases being unilateral, few bilateral cases has also been reported. So this is a classical triad which includes the skin, ocular, and central nervous system. The hallmark of this disease is the fatty tissue nevus on the scalp, that is nevus coeloliparis. So these are the few clinical features in the disease. Hunter and the Moog has proposed a diagnostic criteria for the diagnosis of Haberland syndrome, which involves major systems, and in each system there is a major and the minor criteria. Depending on this major and minor criteria, we can diagnose a case as a definite case or a probable case. So treatment mainly is a symptomatic treatment or a cosmetic treatment to remove the hematomas or lipomas. Neurosurgery or the invasive procedures are spared for the cases which are refractory to medical treatment. To conclude, due to rarity of this syndrome and involvement of multiple systems, a multidisciplinary approach helps to clinch the early diagnosis of this disease and allows for early symptomatic treatment and improve patient quality of life. These are my references. Thank you.
So is this syndrome same as epidermal nevus syndrome? Organoid nevus syndrome. There also you have a neurocutaneous, it's also a neurocutaneous syndrome. So is it synonym?
No, ma'am. Organized syndrome, they have different entities involved in, along with the adipose tissue. This is only the adipose tissue.
Quite rare, both of them. Yeah.
Yeah.
Okay.